The point is that in the last 16 years, the program that we commonly refer to as welfare spends about $1.5 billion less than it did in 1994. I'm hard-pressed to identify any program in state government that can demonstrate such an efficiency during this period of time. And it raises for me a fundamental question about why this program is being targeted and why instead this program isn't being held up as an example about how we can reduce inefficiency in government and yet produce the kind of results that you're hearing from witness after witness today. We are talking about harming and impacting the poorest 1 million children in our state.
It's appalling social policy. It's senseless economic policy for reasons that have already been stated. What I'd like to point out is that it doesn't save the taxpayers of California a nickel. In fact, it costs the taxpayers of California because while the state may save $1.2 billion by eliminating CalWORKs, the counties pick up about $1.9 billion in general assistance costs. So from the taxpayer standpoint, I don't think they know or even care which level of government they're paying the tax to. This actually costs them more than it saves them. And what do they get in exchange? They lose almost $5 billion of free federal money that would go into their economies and stimulate their local communities, build their businesses, and put people to work.
For a net general fund savings of slightly more than $1 billion, we lose $4 billion in federal funds.
If you cut stage 3, I will not have a safe, reliable place to bring my children so that I can be held accountable for my family. And there's just not much choice, you guys will leave me, if any of these budget cuts go through.
I'm a parent of 3 children, and I am a CalWORKs recipient. Thanks to this program, it's allowed me to go back to school. I'm working full-time, and it's allowed me to have my children in a safe, nurturing environment. I just urge you, please support us, and please don't cut these programs.
To lose stage 3 childcare does not mean we would just lose our childcare. For some of us, it means we would lose our jobs, homes, and most important of all, our children's safety and ability to learn.
And if it wasn't for Conejo, I wouldn't have been able to work, and they wouldn't be where they are, and I wouldn't be able to purchase my first home.
That's awesome.
The subsidized jobs program, it's one of the best uses of government money I've ever seen. Because not only are people, they're getting paid to work instead of getting unemployment or just getting a welfare check.
If we give the $2.8 billion back in federal money, I know in my community, this money ain't going to Goldman Sachs. Most of those people spend the money.
The simple answer to your question about has there been a study done of the sales tax impact of this, the answer is no. But the majority of the grants that are received by low-income families are, as you indicated, spent on food and rent payments. The vast majority of food payments, when you purchase food at the grocery store, that's not a taxable expenditure.
But we obviously deal with different sets of poor people. A good percentage of the poor people in my district who are on CalWORKs also are on Section 8 or other types of subsidized housing. So as a consequence, your statement that most of it goes to rent is just factually inaccurate. If I take the fact that they have subsidized housing, and I take the fact that they pay food stamps for their food, which is a non-taxable item, I submit to you again that the majority of the money that they spend goes to taxable items. In fact, the reason that we call sales tax a regressive tax is because poor people pay it at a higher percentage. So you obviously don't spend time in Watson, Compton, and those poor communities that I represent because we do a different kind of economics.
We agree that somewhere between 160,000 children that we serve to up to 240,000 in total will lose care, but we need to mention the families. Over 100,000 parents will be impacted. They will no longer have child care services for them to go to work or to work activities. And we have estimated that about 130,000 providers, that's licensed family home providers, licensed exempt care, teachers and aides, and staff and administrators in our Title V centers will lose their jobs because of this proposal.
How many folks work in the center that you work in?
21.
21 employees?
21 employees.
And how much of the care in there is subsidized care versus folks who pay the full freight?
100%.
Subsidized, okay. So if this program's eliminated, all 21 folks lose a job?
And all those parents.
Cut that line.
I also wanted to point out the fact that family
think you
child care
got it.
providers, we wear many hats. We do food and nutrition, we do payroll administration, we do human resources. I have 2 assistants that I pay out of my pay to come and work with me. So that's 3 people who are employed, myself and my 2 assistants. Every dollar that I make is recycled right back into my community. Every dollar that I make is recycled at the grocery store that I shop at the gas station that I go to, at the stores that I shop at. So everything's turned right back around into my community.
From all of this testimony today, it seems very clear that this is one of the state's very successful programs that offers families, children, opportunity. And I think if you, we really appreciate the position you're in, but we would advocate for spending more money on this project because it shows a terrific track record of success for getting kids out of poverty and getting them ready for being successful in school.
If we lose a big hunk or all of our state-funded support for childcare, it's not as if these programs just press pause and come back magically 6 months or 9 months or a year later. When we lose the infrastructure that we've built for 68 years, we're the only state that kept child care centers open after World War II, and we did it because we recognized that women working kept the economy going even back in 1949. I think you would all, I don't think there's anyone here that wouldn't acknowledge the enormous economic impact that women make and contribute, and we are mainly talking about low-income women. So we can't afford to turn the clock back, press pause, because we will lose the highest quality programs in this state.